Well, welcome, everyone. I'd like to thank you all for coming today to mark the kickoff of our Secure Medicine Return program in King County. We have a heroin and opioid drug overdose every day and a half in King County, and drug overdoses have surpassed motor vehicle accidents as a leading cause of preventable death. The majority of heroin users were hooked on prescription drugs prior to using heroin. And prescription drug misuse is common among teens and is the drug of choice among 12 and 13-year-olds. Most adults and teens who misuse prescription medicines aren't getting them from drug dealers, but from a friend or relative's medicine cabinet. Prescription and non-prescription medicines are a leading cause of unintentional poisonings among children in Washington state. The Secure Medicine Return will reduce the risk of prescription drug overdose and misuse by making it convenient for residents to return and securely discard unused medications at no charge to them in an environmentally sound way. I also want to remind everyone that when it is necessary to take medications, it's important to securely store them away from where others can get them. Healthcare providers and pharmacists should be sure to counsel their patients every time they write or dispense a prescription, both about safe storage and about the availability of Secure Medicine Return. Secure Medicine Return is an important strategy in our fight against drug addiction, heroin, and opioid crisis in King County. Thanks to the strong participation and collaboration between King County government, pharmaceutical producers, law enforcement, and local pharmacies and businesses, King County now has one of the most robust Secure Medicine Return programs in the nation. And to tell you more about this program, it's my honor to introduce Councilmember Joe McDermott.
Thank you. You're going to do yours later. I don't know if you're doing yours now or later.
I'm going to drop my my bottle. I'm going to drop my bottle now. Thank you.
Thank you, Dr. Duchenne. As he said, prescription drug overdose is a national epidemic that has affected every corner of our country, our state, and our county. Washington State has led the efforts in means to address it, a multi-pronged approach that the Secure Medicine Take-Back program is the next logical step in addressing. We began working on a Secure Medicine Return program over 4 years ago during my tenure as chair of the Seattle-King County Board of Health. It was an idea brought to us by Mayor David Baker of Kenmore, a fellow member of the Board of Health who you'll hear from later today. I want to thank David for bringing the idea and leading the charge. After extensive work that engaged local communities, government, pharmacies, drug manufacturers, and law enforcement, we've finally can pause today to celebrate the successful implementation of this program. When used properly, medications can improve our lives. However, 1/3 of medications in King County go unused. These medications that are unwanted and expired accumulate in our homes and can put kids and families at risk of misuse and accidental poisonings. Providing a method for secure disposal of these medicines in these secure medicine drop boxes protects our families and our communities. Working on Secure Medicine Return, I've truly seen the community spirit here in King County. These drop boxes are run by volunteers. All the locations have volunteered to have drop boxes, and the program is supported and operated by drug producers whose medications are sold in King County. I look forward to the success of this producer-supported program. And in particular, I'd like to thank QFC for hosting us here today and for the background music, and particularly QFC's pharmacy merchandiser, Chuck Paulson, and Zach Stratton with the Community Affairs Office for making this a collection site easy for everybody in this neighborhood. And it's now my pleasure to turn the podium over to Zach Sutton. Zach? Take that. I will do this. There we go.
Good morning, and thank you to Councilmember McDermott and Mayor Baker for being here this morning. I also want to thank our Vice President of Merchandising, Michael Cristal, over here in the sharp suit, our store manager, Rich Butler, for hosting us today, and Chuck Paulson, our director of pharmacy, who was really instrumental in partnering with King County and bringing this program to our 20 King County QFC stores. And talking to Chuck about this program, when we were approached about the opportunity to participate, we decided to participate because, and quite simply, it was the right thing to do for our customers in our community. At QFC, we pride ourselves on being the neighborhood store for so many amazing communities around the King County area, and with that comes the responsibility of being a good neighbor in return. QFC is honored to be able to partner with King County in this program. It's a great benefit to our customers, and it's a way to help keep our communities safe. I'm pleased to now drop this medicine bottle into the secure medicine return drop box and turn it over to Mayor Baker.
Thank you, Zach. Thank you very much. I want to take you back a ways and sort of explain why we need this here in King County. I'd like to share the story of my father-in-law, who at the end of his life decided he wanted to die at home. There was a lot of medicines that were given him to ease his pain, to ease the suffering. And when he finally did pass, what do you do with all those medications? Pharmaceutical industry would have it that you put it in kitty litter and throw it in the trash. Yet those are some pretty powerful medications. The visiting nurses said, no, you mix it in with your houseplants and make them happy. Well, and that's eventually going to get back into the system. If you go into the Midwestern part of the United States, there's drugs that come through in small quantities in your drinking water. And it's about time that we woke up and we did something about it. And so we did in King County. It was a long, hard fought battle. The drug companies fought us every step of the way. If you look at the amount of prescriptions that are written in King County alone, only King County, it's over $1.2 billion a year in prescriptions written in King County. Yet the cost of disposal of these medicines to the producers is less than 2 cents per prescription. I think it's a very small price to pay to protect our water supply for future generations. Bringing it back to the present day, we now have 99 collection sites in the county, and over 410 drug producers are participating in the program. And for this, the goal is 1 in every city, and in big cities, 1 more for every 30,000 people. And some of the outlying cities, the small cities, there's mail back that's available for them. But any drugstore in the county that wants to participate can have a drop box. And so we're looking forward to the day that this all increases and there's even greater participation. The pharmaceutical industry is still saying nationally in the state and at the state level, you're supposed to dispose of it in kitty litter and put it in the trash, and they're not changing. And it's kind of funny to me in that they have fought us every step of the way. They have fought Alameda County. They fought different jurisdictions in California who are trying to pass the same legislation. Yet they fully funded programs in Mexico. They fully funded programs in Canada. They fully funded programs in Europe. Yet here, where we seem to pay the most for pharmaceutical products, they don't want to do anything. They want us to continue to throw them in the trash. So, secure medicine return also prevents these medicines from ending up in the environment, as I mentioned before. And rather than my going on and on, like I guess I've been known to do, I'm going to turn this back to Dr. Duchenne and put this in my medicine in the box.
Thank you, Mayor Baker. Thank you, Councilmember McDermott, for your outstanding leadership in making this happen. I want to also thank our friends at QFC for volunteering to host this important program. And I'd like to thank everyone who also contributed to this important program. You know, this is not just a way to prevent children from having poisonings in Washington State through getting their hands on medicine that are lying around that are no longer needed in homes. It's also a key part of our strategy to fight the heroin and opioid drug use epidemic, along with safer prescribing practices, the use of the prescription drug monitoring program, and screening of patients when they come in for care for signs of opioid drug or prescription drug, painkiller misuse, dependency, and addiction. Thank you, everyone.